Do you think that the burning sensation in your chest after a meal or without a meal is acidity, something which we call heartburn? We take an antacid and move on. Well, it can at times be a serious problem, a heart attack. As a cardiologist, I'm often asked, how do you differentiate heartburn from heart attack? Let's break this down. So what are the signs, symptoms that we differentiate heart attack from heartburn? They generally overlap, but there are few cues which tell us this is heartburn and this is not heart attack. So if you get a burning in your chest after a meal and you feel the reflux of acid coming right up to your throat, then it's most likely acidity. Whereas a classical heart attack, chest pain or burning sensation can go across the entire chest. You may feel a pressure on your chest, and that chest pain can radiate to the shoulder, to the jaw, and go to your back. But again, it can happen similarly in heartburn also. Now comes the relieving factors. The relieving factors in acidity is generally, as a kid, your mother used to give you some cold milk and you felt better. And this has been replaced by drinking an antacid or having an antacid pill and you start feeling better. Or if you have a meal, you start feeling better. This is generally a sign of acidity, whereas these changes may or may not happen in a case of a heart attack. Some heart attack pains may respond to this antacid because heart attack can come with acidity at the same time. So we need to differentiate that. The most important feature is look for the red flags that are around. And the important red flags that you're dealing with a heart attack is that if you have associated shortness of breath, acidity very rarely gives shortness of breath. So if you feel shortness of breath at that time, then you may be dealing with more than an acidity. And you might get nausea, you might feel weak, you might get vomiting, you might get cold sweats, and you suddenly break into a major sweat. And this is typical of heart attack. But not to forget the most important sign, which is called the elephant sign, or also I call it the rubber band sign. It's a sign where you feel your entire chest is squeezed like a rubber band and it's not letting go. Whatever you do, you change position, you drink water, you move, you drink an antacid, it refuses to go. It goes down and comes back. These are all warning signs of a heart attack. Don't let the signs scream out loud. Consult the heart expert today and unmute your heart.